My name is Jerry Hesch. I'm a physical therapist. I work in Henderson, Nevada. I work part-time. I also teach seminars on the Hesch method. This is my contact information. And I also have a website. And we have a very interesting client today. She works as a physical therapist assistant, and there are several things going on with her structure. For the purpose of this film, we're focusing on the right inferior pubic bone. Similar to this model, the right pubic bone is lower. Now, the reason that I suspect that the right is dysfunctional is that when I palpate the sacrospinous ligament and the sacrotuberous on the right side, they are much more taut. They are much tighter and more painful. I can also do a mobility assessment. However, I want to explain what I find with palpation. With palpation, I find a definite step off. Now, if the pubes were symmetrical and the pelvis was simply tilted to one side, then I would be able to feel straight across the pubic bones. But what I actually feel with her is I feel a distinct step off coming from the left pubic bone onto the fibrocartilage. And then when I go from the fibrocartilage onto the right pubic bone, I feel another but a smaller step down. Of note, her whole pubic structure is much more anterior than the ASIS's. Very rare to see this. To be honest, it's maybe a quarter of an inch, maybe a 3/8 of an inch anterior, but you just don't see that very often. Anyhow, I don't know if you'll be able to visualize adequately with the camera. Let me move it a little bit. So here's midline. I'm on the left pubic bone, and as I come across, right there is a step off. So I fall off there, and as I come further, there's a secondary step off. I hope you can see the difference in height there. It's really remarkable because it is a considerable distance. It's on the order of 3/8 of an inch. That is considerable. We'll see some subtle ones. Very rare to see this much of a difference. With respect to mobility test, I can load the top on the left and try and spring it inferiorly, but there's no motion. I'm putting plenty of force. That's at least 10 pounds. I'm doing the same thing on this side. And I would submit that when it's shifted like that, you're not going to have mobility on either side. You're not going to have mobility either going up or going inferiorly. Yeah, and in terms of going posteriorly, there's no mobility there. Going posteriorly here, there's no mobility, but she does have mobility when I move the ilia. Okay. However, it doesn't rotate normally. A fair amount of the motion comes over to the other side immediately in the transverse plane. So there is something unusual about the way that the ilia are moving in relationship to the sacrum, or even as coupled with the sacrum, if you view it from just a pelvic model. But that's all I want to say for now. I just wanted to point out the uniqueness of this step down. Again, if the entire pelvis was simply shifted, then it would have been a straight plane. It wouldn't have been two sets. It wouldn't have been two separate step downs. That's the point that I want to make. We're going to initiate treatment fairly soon. We'll probably come back and film, or either I'll put a little caption below the film and explain what the rest of the story. Thank you.